I'm washing my hands. Hello, Mr. Hoffman. How are you today?
Doing well, thank you.
My name is Nancy. I'm going to be doing an assessment of your heart and the vessels in your neck today. So I'm going to start out by asking 2 questions. Do you have any history of heart disease?
I do not.
Have you ever had a heart attack or a procedure where they put in a stent?
No, I haven't.
Heart failure?
None.
Okay.
No.
Do you ever experience any chest pain?
I do not.
Okay, good, good. All right, so we're going to start out by looking at the veins in your neck, and for that I need you to lay down at a 45-degree angle in a supine position, which means flat. And I'm going to ask you to turn your head a little bit to the left, and I'm looking at the vein right here in your neck, and it should be flat. That would be normal. Some people you could see the vein, especially if the skin tone is very light. Other people you cannot see it at all, but there should be a notice of it that it's flat. If you see the vein itself is large or bulging, that'd be an indication of an increase in pressure there, which would be abnormal. All right, that's good. I'm going to have you sit back up. And I'm going to palpate your carotid pulse. So I'm putting my fingers right next to the trachea at about midway up the neck. And what I am feeling for is the strength of the pulse. A normal strength would be 2+. I am also feeling for the upstroke. It should be nice and smooth and strong. And then I'm going to also do the same thing on the other side. And then I feel that this pulse is 2+ and the upstroke is smooth and strong. Then I'm going to listen to the carotid arteries. I'm listening for a bruit, which is a swishing sound, and I'm going to listen with the bell of my stethoscope, which is the part of the stethoscope that will hear a low-pitched sound. So I place my stethoscope about halfway up the neck, and you take a big breath in and out and hold. And I should just hear the pulse. I should not hear any swishing. And breathe, and take a breath in and out and hold. And I hear the pulse. You can breathe, but I don't hear any swishing. Then I'm going to move down to the chest. I'm looking at the precordium. The precordium is the part of the chest that overlies the heart. And I'm looking to see if I see any pulsations or any movement there, which I only see normal respiratory movement. And then I'm going to palpate the point of maximal impulse, which is at the mid-clavicular line and the 5th intercostal space. So it's going to be, if you put your fingers right here on the ribs, feel in between the ribs, and then you'll feel that pulse. All right, and then I'm going to move on to auscultating the heart. So you start by finding the 2nd intercostal space. So you can either count down from the clavicle, okay, there's space 1 and there's space 2, or you can find the angle of Louis. This is the part of the sternum that protrudes a little bit, and right across from there is the 2nd intercostal space. So I'm going to start by listening with the diaphragm. So make sure that you have your stethoscope set up the right way. Start in the aortic area. Just have the person breathe normal. And I'm listening for the S1 and the S2, the lub-dub. And I'm listening for any clicks or extra sounds or murmurs. Okay, that's the aortic. Right across from that, 2nd intercostal space to the left of the sternum is the pulmonic area. And then as we move down, I'm going to listen to the left at the 5th just right next to the sternal border. And then finally at the mid-clavicular line, the 5th intercostal space, the mitral area. So I heard S1, S2, the lub-dub. I did not hear any clicks or extra heart sounds, and I did not hear any murmurs. Now I'm going to do the same thing with the bell of the stethoscope. So second intercostal space to the right of the sternum, the aortic area. Then to the left of the sternum in the second intercostal space, the pulmonic area. Okay, right next to the sternum, the fifth intercostal space, the tricuspid area. And then finally, the midclavicular line, fifth intercostal space, the mitral area. And I heard S1, S2. I did not hear any extra heart sounds, and I did not hear any murmurs. And so that concludes the assessment of the neck vessels and the heart.